You can inherit many things from your family, such as hair color, eye color, and even mental and physical predispositions. I'm going to talk about borderline personality disorder and how a person navigates it. According to the National Library of Medicine, BPD is defined as a mental health disorder in which a person lacks stability in their relationships, self-image, and emotions. This disease can also manifest in symptoms of impulsivity, self-harm, and even severe dissociation. The National Library of Medicine goes on to say it was first introduced in the 1980s in the Diagnostical Statistical Manual 3 and hasn't changed much since being in the DSM-5. So this is the DSM-3 and this is the DSM-5, and it was published by the American Psychiatric Association. The term borderline comes from psychiatrists attempting to explain what it's like being between neurosis and psychosis, or in other words, bordering, which is where that word comes from. BPD, more often than not, comes about from extreme trauma, typically in your childhood from abandonment. Until BPD was recognized as its own mental health disorder, psychiatrists and therapists had trouble placing where their patients could go. You may be wondering what the current prognosis is for this disorder, and treatments for patients can vary. However, the most common treatments include medication and psychotherapy. There are a range of medications psychiatrists can prescribe, often depending on their specific symptoms, situations, and needs. The most common forms of medications given are antidepressants, mood stabilizers, antipsychotics, and anti-anxiety medications. Psychotherapy is a very common treatment for those with other disorders. However, with BPD, it is incredibly helpful for assessing a patient's ability to function. According to the Mayo Clinic, there are a few forms of talk therapy that are often very helpful for those struggling, such as dialectical behavior therapy and cognitive behavioral therapy. While these treatments are typically a good good for those struggling, they are not a cure. More recently, psychiatrists have come up with newer approaches to psychotherapy, like mentalization-based therapy or EMDR therapy. These are some of the medications like sertraline and lithium. The newer treatments, the more experimental ones like mentalization-based treatment or EMDR therapy, try and get to the root of the issue instead of merely treating the illness. While I hope there will one day be a cure, it is important to think about what is causing borderline personality disorder, which is child abuse. Here are a few local support groups for child abuse and domestic abuse. So these are both in East Texas, East Texas Crisis Center and CASA for Kids of East Texas. And this one, Children's Advocacy Center, is in North Texas. So these are all Texas-based However, these are very local. Thank you.